Let me ask you something important. If I asked you right now which blood pressure number is more dangerous, the top one or the bottom one, what would you say? Most people confidently answer the bottom number, and that answer has quietly cost thousands of people their independence, their memory, and sometimes their lives. Because after the age of 60, focusing on the wrong number can create a dangerous illusion of safety. In the next few minutes, I'm going to explain exactly which blood pressure number matters most after 60, why it becomes more dangerous as you age, and how ignoring it slowly damages your brain, your heart, and your kidneys, often without any warning signs. And yes, this information can genuinely change the course of your life. So stay with me, because what you're about to learn is not what most people expect. Let's start with something familiar. Every time your blood pressure is checked, you see two numbers, one on top, one on the bottom, one on the, you've heard them for years. But almost no one ever explains what they really mean in a way that helps you protect yourself. Blood pressure isn't a single number because blood flow isn't constant. With every heartbeat, pressure rises and falls. The top number, called systolic pressure, measures the force when your heart contracts and pushes blood forward. The bottom number, diastolic pressure, measures the pressure when your heart relaxes between beats. So far, this sounds simple, and for decades, doctors treated both numbers as equally important. If either one was high, you were told you had high blood pressure. But then researchers started doing something different. They followed millions of people for decades. They tracked who had strokes, who had heart attacks, who developed heart failure, who lost kidney function, and who died early. And something very clear began to emerge, especially after the age of 60. Let me paint two very common scenarios. One person has a blood pressure reading like 165 over 70. They feel relieved. The bottom number looks great. They may even be told, yes, the top number is a little high, but your bottom number is excellent, so don't worry too much. Another person has a reading like 128 over 95. They panic. They read online that the bottom number is dangerous. They assume a heart attack is inevitable. Here's the problem. After 60, these two situations do not carry the same risk, and many people are worrying about the wrong one. Large population studies show that after age 60, systolic blood pressure, the top number, becomes the strongest predictor of serious cardiovascular events. Stronger than diastolic pressure. In many studies, it's 2 to 3 times more predictive of stroke and heart attack in older adults. And here's where it gets even more important. As people age, something very specific happens. The systolic number tends to rise. The diastolic number often stays normal, or even goes down. This pattern is extremely common. It's called isolated systolic hypertension, and for years it was misunderstood. Some people believed it was just normal aging. We now know that belief was dangerously wrong. Isolated systolic hypertension is one of the strongest risk factors for stroke, heart failure, kidney disease, cognitive decline, and loss of independence. Treating it has been shown to dramatically reduce stroke risk and save lives. So let me say this very clearly. If you are over 60, the top number on your blood pressure reading is the most dangerous number. Now let's talk about why. Because once you understand the mechanism, everything clicks. When you're young, your arteries are flexible. They stretch when blood is pumped through them, then gently bounce back. This elasticity protects your organs from pressure spikes. But arteries don't stay young forever. Over time, elastic fibers break down. Stiffer tissue replaces them. Calcium deposits form. Plaque accumulates. Your arteries slowly turn from flexible tubes into rigid pipes. Now imagine what happens when your heart pumps into stiff arteries. They can't expand, so pressure shoots upward. That's why systolic pressure rises with age. And during the resting phase between beats, those stiff arteries don't recoil very well. So diastolic pressure may stay normal or drop. This creates a dangerous illusion. People see a good bottom number and assume they're safe. But the high systolic pressure is quietly hammering their organs. Every single heartbeat. Your brain is especially vulnerable. High systolic pressure damages tiny blood vessels in the brain. Some rupture, some narrow, some quietly stop delivering oxygen. Even without a major stroke, thousands of microscopic injuries can accumulate over time. This contributes to memory loss, confusion, and what is often labeled as Alzheimer's disease, but is frequently vascular damage instead. Your heart suffers too. To push blood into stiff, high pressure arteries, your heart has to work harder. The muscle thickens. A thick heart becomes stiff. It fills poorly. And over time, this leads to heart failure. Not from one dramatic event, but from years of silent strain. Your kidneys are also at risk. They rely on millions of tiny filtering vessels. High systolic pressure damages them slowly. And once kidney function declines, blood pressure becomes even harder to control. A vicious cycle begins. Now, here's something that confuses many people. What if my diastolic pressure is low? Doesn't that mean I'm safe? No. A high systolic combined with a low diastolic creates a wide pulse pressure. That often signals severe arterial stiffness. And if diastolic pressure drops too low, the heart muscle itself may not receive enough blood during rest, increasing the risk of chest pain and heart damage. So, yes, both numbers matter. But after 60, if you had to choose one number to watch like a hawk, the science is very clear. It's systolic pressure. So, what should you actually aim for? Most modern guidelines define high blood pressure as 130/80 or higher. For many adults over 65, the goal is to keep systolic pressure below 130 if it can be done safely. The key message is simple. If your systolic pressure is consistently above 130, and especially above 140, this is not something to ignore. Now let's talk about what actually works. First, lifestyle changes matter. A lot. Reducing sodium intake can lower systolic pressure by several points. Most sodium doesn't come from the salt shaker. It comes from packaged foods, restaurant meals, sauces, breads, and processed snacks. Weight loss helps too. Even modest weight loss can reduce systolic pressure. Regular movement matters. Walking most days of the week improves blood vessel function over time. Alcohol matters. Too much alcohol raises systolic pressure more than many people realize. Sleep matters. Poor sleep and sleep apnea are strongly linked to elevated blood pressure. Stress matters. Chronic stress keeps your nervous system in a constant state of pressure. But here's the reality many people don't want to hear. For many adults over 60, lifestyle changes alone are not enough. Medication is often necessary, and that is not failure. Blood pressure medication is one of the most effective tools we have for preventing stroke and heart attack. Many people need more than one medication. That's normal. The goal is not perfection. The goal is consistent protection. If side effects occur, the solution is adjustment, not stopping on your own. Home blood pressure monitoring is also critical. Office readings don't tell the full story. Home monitoring shows real patterns. It empowers you, and it helps your doctor make better decisions. Now let's address two dangerous myths. First, my parent lived a long life with high blood pressure. That's survivorship bias. For every person who survives, many others don't. Their stories are never told. Second, I feel fine. High blood pressure is called the silent killer for a reason. The first symptom is often the catastrophe. Waiting for symptoms means waiting too long. So let's make this practical. And if you're over 60, know your blood pressure. Focus on your systolic number. Don't let a good bottom number distract you. Make lifestyle changes part of your daily routine. Take medication if prescribed. Monitor at home. Stay engaged with your care. Your heart has worked for you for decades. Every beat matters. And now you know which number truly predicts your risk. The top number. Don't ignore it. Don't underestimate it. And don't let it quietly steal your future. Now you know. This video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease. The information presented here should not be considered medical advice or a substitute for professional medical care. Always consult with your physician or another qualified healthcare provider regarding any medical condition, symptoms, or treatment decisions. Never ignore professional medical advice or delay seeking medical care because of something you have heard or seen in this video. Any changes to medications, lifestyle, or treatment plans should be made only in consultation with a licensed healthcare professional. Thank you for watching. If you found this video helpful, please subscribe to my channel for more clear, evidence-based health information. And feel free to share this video with someone who may benefit from it. Your support helps this channel grow and allows me to continue creating content that truly makes a difference.